Hello, everybody. We are coming to you with a case. Actually, this person lives two floors above us as we speak. And this person is 69 years old, female, and has a long history of health issues. So we're talking COPD, anxiety, hyperthyroidism, diverticulitis, Barrett's esophagus, IBS, frequent falls, atrial fibrillation, chronic pain. That's actually a big one with this patient. Um, Sciatica, dysphagia, depression, and anxiety. And because she has all these diagnoses, she's also on a lot of medication. We're talking just basically everything that she has is being treated with some kind of medication. She was on more medications when I first met her, and she definitely has empowered herself to talk to her doctor, and she had a lot of her medications adjusted, and she has come off of some of them. This patient has been smoking for 45 years. She smoked about a pack of cigarettes every day, which is about 20 cigarettes every day. She has tried to smoke many times in the past. She says she's been trying to, yeah, she's been trying to quit. She says ever since she started smoking, she's been trying to quit. So she's been trying to quit for 45 years. She has done one-on-one. She has done um, group counseling at San Francisco General Hospital. She has seen our behavioral health assistant, Janelle, multiple times. She has used the patch, the gums, the lozenges, and she also used Chantix in the past before. She has been referred to every smoking cessation program that we have. She's been referred to most of the smoking cessations that are available to her outside of Curry Senior Center, and that would include, like I said, San Francisco General. She also has a regular psychiatrist that she sees at CCOA, which is Central City Older Adults. And they also do smoking cessation with her there as well. Physically, for the most part, we see her just about every other day. And she is
very active.
Yeah, she is still very active. She actually has a part-time job. She walks basically to her part-time job, which is probably like a 15-minute walk every day back and forth. She has a pet, which she walks all the time as well. So she is actually very active. She is very connected socially. She definitely comes to many of our programs here, like our social programs. She also comes to many of our health programs. She's basically a standing member at all of my health education programs here at Curry. So she's very, very well connected. She has lots of support. She has done all the smoking cessation programs that we have been able to offer her. And what we're looking for now is kind of like what we do next, like what are our next steps when it comes to a patient who has all of the support and we just still haven't got that, we're still not just connecting yet to get her to attempt to quit smoking again.
Yeah, I would echo what Umberto says. She's very connected to all the services at Curry. She has friends. I would say that her family life is probably her biggest source of trauma, and she has relapsed into smoking because of family struggles, deaths in the family, conflicts, and she's gone back to smoking, she's told us, as a way to deal with that, anxiety and stress of the family things that she has going on with what she had in the past 6 months or so.
Yeah, she's also said that her stomach issues, her digestive issues, are also a reason why she's kind of like afraid to stop smoking, because she feels like she's going to gain weight if she quits smoking, and that's just going to make her IBS worse, and that's going to make her heartburn worse. So she's also kind of afraid that if she stops smoking, she's going to gain weight.
Great, thank you. This is a great case, of course. Sounds like, I bet a lot of people can relate to patients with complex medical conditions, behavioral health conditions, and then other social challenges. So resonates with, I think, a lot of us. Anybody have clarifying questions? Anything that you want to ask more about or have any questions about?
One came in the chat.
So in the chat, let me look. So Sean, thanks for the question. The question, I'm just going to read it for everybody. Has any sort of incentive program been set up for her? Meaning she could, like, if she saves $10 of her own money per week by maybe buying one less pack of cigarettes a week, and once it reached a certain amount, she could get a big reward, something like that. Any thoughts on that, Umberto, in Curry Senior Center?
So when I first started working here at Curry about 5 years ago, I actually, me and her worked together one-on-one for a long time, and she did actually quit smoking for 6 months as I was working with her, and we didn't do an incentive program like that. What I was doing with her was I was celebrating like milestones. So I made her like a poster that said congratulations on 1 month of being smoke free. At 6 months I made her like a big pin that was like, I haven't smoked in 6 months. Like I was kind of like incentivizing her that way, which is something that if you knew this patient, she actually really enjoys having attention put on her like that. But we've never actually gone as far as like actually incentivizing it monetarily, no.
Great. Thanks for that additional information. That sounds fun. Other clarifying questions?
This is Maggie from St. Louis. I have a quick question. Do you all have like an exercise program available to your patients? Because it sounds to me like since she is physically able to exercise, that may help with her stress level and potentially lose some weight so she can get off some of those other medications. Is that an option?
Absolutely, yes. So we have definitely a lot of options for exercise, especially here in-house. On Saturdays we have Tai Chi, and she lives, like I said, right upstairs, so she definitely has that option. We also, across the street and over one block, we have
The gym. We have the Salvation Army has a low-cost gym for seniors.
Yeah, which she has been a member on and off since I've known her. And we've definitely had exercise programs here before that she has been a part of. I used to do Tai Chi as well with her.
But it's
great.
What her interest is in exercise going forward, because she had a lot of medical conditions last year that kind of, I think, threw her off from her exercise. So it's a good question to ask. If she's like interested in getting back into that.
And kind of along the lines with the incentives that they mentioned before, I know, I'm incented by money when it comes to dieting. So, having a little incentive there for whoever loses the biggest percentage of weight might get a prize of some sort or something. So, and it might help her all around.
That's great. Good ideas. It sounds like it's really unique. Seems like, maybe I just haven't heard it, but you have a long-standing relationship with this patient, both in your community. It sounds like she's sort of a big community member, so that's really great. I see one more question in the chat from Christine about would the client consider how her smoking affects her pet? Since her pet sounds like it's a big part of her life, would that be something that would resonate with her or not?
Absolutely. Lolly is her main source of companionship and affection. Yeah, she loves that dog. I feel that could definitely be something that could be an incentive for her to attempt smoking.
I think we actually ordered some brochures from one of the sites about
How smoking
how
affects
smoking affects
your pet. Yeah.
That's great. That's a good, nice angle. Any other clarifying questions?
Hi, this is Latoya from New York. I have
Uh-huh.
a question, more of a curious question. In New York, they often run commercials, like anti-smoking commercials, and they're showing real people with holes in their neck or distorted faces from the side effects of smoking. And I just wonder, like, the curiosity behind that. Does that really affect the smoker? And I know this patient is concerned about weight, but was she educated on the deadly effects of smoking? And did that affect her in any way?
Oh yeah, so the thing, so we get those commercials here too, like the lady who speaks with the little voice thing in her box, or yeah. So she's definitely well aware of the other issues that can happen if she doesn't stop smoking. I think that for her, she puts them in order of what's affecting her right now the most. And I feel like those effects on smoking, she kind of puts at the way bottom of her list. I mean, and I can definitely understand that, seeing as it takes years before, you develop cancer or other things. So she compartmentalizes it in a lower priority than she does her other health issues.
And some of it is for her to just get through the day. She has a lot of anxiety that sometimes paralyzes her, and I think she looks at smoking as a
Yeah, smoking sort of seems to be part of her self-medicating for her anxiety and other emotional distress.
Yeah,
Like.
she have any other drug or alcohol use or anything like that. Really, smoking is her one vice, I guess.
Yeah, she did have an issue with alcohol in the past, but she's been sober for like 15 years already.
Yeah.
Yeah, oh, great. That's great.
Is her one thing. She says smoking and ice cream is all I have.
Yeah.
I feel bad for, so
I can relate to the ice cream for sure. These are great questions. I'm going to transition us into the sort of the faculty part of things. Linda, did you have something you wanted to jump in on?
Sure. Thanks so much for presenting this case. I was really shocked at all her health issues and how she was still able to quit once, which I think is really great news. And, if you were able to work with her for that quit in the past, I think just reminding her of that and reminding her that she can do this and she has done it and she felt better. I mean, maybe even inviting her to share with you some of what she viewed as really the best parts of quitting in the past, just to remind her and bring fresh into her memory how much better she felt. Maybe she was able to, walk on a faster pace or take her dog out more. She felt better. Maybe food tasted better to her. Maybe even her ice cream tasted better to her. All of these things that are benefits of quitting. And, when the Surgeon General's report comes out later this year, I've heard there's a chapter on the benefits of quitting. And I think that will really help inform all of us, where we can say, hey, it's been proven. These really are the benefits of quitting, not just the health effects, excuse me, and reducing back your risk, but other benefits. So I would say remind her and really just walk through that experience of how she quit in the past, what the challenges were and how she overcame those challenges, and really how much better she felt. I think those are all really good things to remind her of. In terms of the weight gains, we do have some materials, and I'll email Sharon Cummins. I didn't see her on the list today, but just to see if they have some California specific ones that she'd like to share with you. But we certainly have some also that we can share with you there.
Great. Thank you.
Thanks, Linda. Amy or Frank, anything to add?
Yes, I have a lot of stuff. So first of all, I would echo what Linda said. That was the first thing on my list, is what worked. She obviously was able to quit for 6 months, so something worked. So make that very clear and understand that on your end and on her end. The pet thing, I can't emphasize that enough. I have worked with probably 50, 60 people, and whose reason for quitting, whose motivation was because they understood that their pet was going to get cancer if they continued to smoke around them. And that is real. Dogs can get lung cancer from being around secondhand smoke. So that would be the motivation that I would really work with. The barrier, on the other hand, and you said it right a few minutes ago, if she really believes that the only thing she has in her life that is good is smoking and ice cream, she's not going to quit. So you really need to work with that belief system and help her understand that, first of all, that's not probably true, that there are many other things that are positive in her life that she, you said she has a big social circle, so there's people, there's a lot of other activities, she has work, whatever it is, focus on that. Get her to understand that the smoking she's almost looking at the cigarette as a friend, and it's the only friend she has, and that it helps her deal with life. So I know this is getting really psychological, but I think that's where the problem lies. You really need to disavow her of that belief and show her that a friend does not steal all your money, ruin your health, and lower your self-esteem.
Right.
And that's really where I would focus. And then once you get her to understand that, she probably has no other way of dealing with stress.
Mm-hmm.
I would really focus at the beginning here on teaching her some very strong, very good stress management techniques. You mentioned the Tai Chi, that's great, but I think a lot of it for her might be cognitive, and teaching her some cognitive ways of dealing with the stress. Which then leads me back to when someone relapses after 6 months, that is not because they're in withdrawal or anything physical. It's because they made a conscious decision to smoke.
Mm-hmm.
So I would really ask her when you have the opportunity to tell you exactly what she's told herself that led to that very first cigarette. And you're really going to learn then what her thinking process is, what her beliefs are, etc. But I've always found that most people, when they relapse, kind of think it just happened out of the blue. So it's really helpful to unpackage all of it and show them that even if they have the thought of, I want a cigarette or it's going to help me, that they can stop then. They don't have to go get it. If they end up at the store and they're going to buy the cigarette, they can stop themselves from actually buying it. Even if they bought the pack, there's still an opportunity to say, I'm not going to smoke these. So there's plenty of opportunities and plenty of places where they can actually stop the forward motion of actually getting the cigarettes and smoking them. But my sense is very strongly is that you really need to focus on this whole belief system she has, that this is the only friend, this is the only way she can cope, this is the only way she can deal with anxiety. And just to finish up, I think you need to also show her that she's actually making her anxiety worse.
Mm-hmm.
All and anxiety pretty much feel the same, and she's in withdrawal all day long, to some degree or another. So when she smokes, she feels better, but all she's doing is getting rid of the withdrawal. She's not getting rid of the anxiety. It's still there. So the withdrawal is actually exacerbating the anxiety symptoms in many ways.
Thanks, Frank.
Thank you.
That's really helpful. That's some really practical, helpful tips. I like that. And Linda too, thank you. And how about Amy? Anything to add? Or Steve? Amy or Steve?
Mm-hmm. Yeah, this is Amy. So thanks for sharing that case, and thank you for all the work that you have been doing with her. She really has had a lot of intervention and utilized all those resources available to her. And being quit for 6 months is such a huge accomplishment. So a little bit of a unique suggestion, but to kind of help her capitalize on that great success in quitting, even just for those 6 months, and maybe a way to feel ownership over her success. And especially that you mentioned how social she is, very involved, has a lot of people around her, maybe being a role model. So if there's a possibility of taking more of a leadership role, so if she can help kind of share her experiences, maybe take a lead in some of the group classes that she's in or in other classes that she attends there, to maybe share her experiences, share how she has been successful. She can have kind of a prominent role in that and being that role model in quitting. Similarly, if she can be somewhat of a peer partner, so if she has someone who does want to quit, kind of buddy up with them, but be more of kind of that expert in quitting. Since she got through those 6 months, she really learned a lot, has a lot of skills and that success in quitting, with using different medications, kind of knows the ins and outs of those, the different situations that she had been through, and was able to overcome and stay quit for those 6 months. So really trying to kind of capitalize on that, similar to peer recovery coaches who are often successful in staying quit from whatever substance they're on, because they're constantly reminded of those skills, those coping mechanisms. They're constantly talking about those with people and helping them manage those same things that would help them quit and stay quit. So kind of being in that role might be helpful to her, especially because she's social, and might give her that kind of motivation and ownership, and be more successful in the long run, and kind of looking at that as a way to give back, and to help others. And again, that can kind of help her stay motivated and stay quit. So kind of a unique suggestion, but maybe something that might help her throughout that future in quitting.
Great. Yeah, I think she likes to have that kind of community around her, and she has some people that they have a small group, and we've seen them in lots of classes repetitively. So I think we could definitely work with something like that.
Yeah, she also is part of camp, and didn't she take initiative to be like on a separate little like group where so that would be definitely something that she would be into. Yeah.
Great. Yeah.
One more thing from me, I just happened to think of, she may be somebody that's going to need to be on nicotine replacement therapy long term. So I don't know how long she was on it before, but don't be afraid to let her stay on it for a year, 2 years if she needs to. The data is very clear. There is no untoward effects from somebody being on it that long. And in some cases with some people, that may be part of the issue too. So, you might want to explore that. She may have gotten off the medication too soon.
Mm-hmm.
Okay.
Long-term continuous use she might be a candidate for that.
Okay.
Good thought. Thanks, Frank. Very good thought. Steve, anything to add?
Well, first of all, I would say that the comments from Linda, Frank, and Amy were spot on. I want to compliment the Curry folks for really going the extra mile on this patient. That happened at the last echo session too. I'm impressed with how much care you're giving to these patients, to these clients, and that's impressive. And these are tough. I also want to reemphasize the fact that she stopped for 6 months. And you might want to let her know that a lot of people can't do that. So she's already shown that she's able to stop. Let's focus on the drugs for a moment. I would restart her on the varenicline and the nicotine patch because it worked previously. But if that fails or she doesn't want to do it, you might want to talk to her psychiatrist and see if she wants to change the antidepressives and go to bupropion, which is both an antidepressive and a stop smoking drug. That's a tricky transition. And so you don't want her depression to get worse during that transition. So I would try to coordinate that with her psychiatric caregiver. But I think there's a sort of a glass half full part of this, in that she was able to quit previously. I think the issue of the PET is really brilliant, and see if you can do that. But these are tough. Also, let her know that the average person who quits may try from 12 to 30 times before they're able to fully get off. So a lot of people think, oh, I've quit, I'm consigned to smoking for the rest of my life. Not true.
Okay, thanks, Steve.
Yeah, awesome. Thank you.
Yeah. Great. Any other thoughts from anybody, faculty, other participants, any other thoughts or ideas on this case before we move along? Frank,
Yeah,
looks like you're ready. Yeah.
Just real quick to dovetail on what Steve just said, frame this whole thing as a learning process. Quitting is a learning process. She, in effect, had to teach herself how to smoke. So this is just learning a new behavior, not smoking. So ask her, especially with this 6-month quit, because that seems to be the longest she's been quit, and what did she learn about herself during that period? And then what has she learned about herself, you know, from all these relapses? So you might use the metaphor of riding a bicycle. Very few of us have ever just gotten on a bicycle the first time and been able to ride. We fall off, scrape our knees, whatever, but then we figure out what we did right and what we did wrong. So that kind of then makes all of these attempts that she's had into a positive rather than a negative.
Mm-hmm. Yeah, I like that idea, especially for her. She really responds better to you know, glass being half full, because she can tend to be somewhat negative. So we try and focus on the positive for her.
Yeah, so I would just literally ask her, what have you learned about yourself during this process? And that'll give you a lot of information to work with in terms of you know, what theme positive self-esteem she has, and then what she considers to be her problem areas. It'll be probably very specific if you ask that question, and that'll give you something to work with then.
One thing I'm really confident about is that, you know, we've told her about this new project we're working on, and she's very eager to kind of participate and do like a new intervention with us. So I think the stage is being set for her, you know, that she's really ready to gear up for another attempt. So we're pretty excited about that.
Yeah, and I think that using Lolly, her dog, kind of, yeah, because definitely she's the type of person who would do really anything for her dog. So maybe smoking should be that anything for her.
Yeah, and there's a lot of real evidence to show that dogs do get lung cancer from secondhand smoke. So it's not something we're making up or spreading the truth on. It's very real.
Mm-hmm.